And radionics, which is also known as electromagnetic therapy, EMT, or the Abrams method, is an alternative medical approach claiming the ability to diagnose and treat ailments through the application of electromagnetic radiation, EMR, including radio waves, using electrically powered apparatus. This methodology shares similarities with magnet therapy, which employs EMR but utilizes a magnet to generate a static electromagnetic field. The inception of radionics traces back to the publications of two books by American physician Albert Abrams in 1909 and 1910. EMT imbalances in electromagnetic fields or frequencies within the body contribute to the onset of diseases or other health issues by disrupting the body's chemical equilibrium. Administering electromagnetic energy from external sources is believed to rectify any such imbalances. Much like magnet therapy, electromagnetic therapy has been advocated by alternative medicine practitioners for a range of purposes, encompassing ulcers, headaches, burns, chronic pain, nerve disorders, spinal cord injuries, diabetes, gum infections, asthma, bronchitis, arthritis, cerebral palsy, heart disease, and cancer, as outlined by the American Cancer Society. Not so many years ago, when I was a drug regulator with the state of Florida, I would have told you that if something cures everything, it's quackery. I used to do a presentation entitled How to Spot a Quack. All that went out the window when I learned about energy healing and the nature of the universe. Dr. Abrams was born in San Francisco and received his medical degree from the University of Heidelberg in Germany. He later returned to the United States to practice medicine. In the early 20th century, Abrams began developing his theories on the existence of energy fields in the human body. He believed that these energy fields could be measured and used to diagnose various health conditions with special instruments. Abrams invented a device called the oscilloclast, which he claimed could diagnose and treat diseases by transmitting electrical impulses through the body. The oscilloclast was essentially a type of electronic device with dials and wires, which Abrams used to detect and analyze the supposed energy fields of patients. Abrams proposed that every disease had its own unique energy frequency or vibration, which he called the dynamizer. He claimed that by tuning into these frequencies with the oscilloclast, he could identify the presence of disease in patients. Radionics practitioners believe that every living thing emits a unique energy pattern or frequency, often referred to as a vibration or signature. These patterns are thought to reflect the overall health and well-being of the organism. By detecting and analyzing these energy patterns, practitioners claim to diagnose illnesses and imbalances. Before we go on, I'd like to ask you to interact with my channel by subscribing, commenting, sharing, and/or liking. It really helps me strive towards a way that I can continue to do my channel full-time and hopefully even grow it to reach more people. So share whenever you can and tell me what I can do to make you a loyal subscriber. Okay, on to the various techniques and devices that can be attributed to radionics. Radionics devices typically consist of a combination of dials, electronic circuits, and antennas. Practitioners use these devices to tune in to the energy fields of patients or substances. They may also use a sample of the patient's hair, blood, or saliva as a witness to establish a connection with the patient's energy. Practitioners claim to detect and analyze energy patterns using specialized devices and techniques. Here's an overview of some of the methods they employ. Dowsing. Some practitioners use dowsing techniques such as holding a pendulum or using dowsing rods to detect subtle energy fields. They believe that the movement of the pendulum or rods can indicate the presence of energy imbalances or disturbances. When I took a class in spoon bending earlier this year, we used dowsing to choose the spoon that we were going to use from a large pile of spoons, and we're told to choose the one that best aligned with our energy. Radionics instruments typically consist of a combination of dials, electronic circuits, and antennas. Practitioners use these devices to tune in to the energy fields of patients or substances. The practitioner may hold a sample of the patient's hair, blood, or saliva in contact with the device to establish a connection with the patient's energy. Another technique which can be used is witness samples. In some cases, practitioners use samples of the patient's biological material, such as hair, blood, or saliva, as witnesses to establish a connection with the patient's energy field. These samples are often placed in a special compartment or well on the radionics device. Then there's broadcasting rates. Radionics practitioners often use sets of numbers or rates associated with specific health conditions or treatments. These rates are typically selected based on intuition, consultation with a reference book, or through analysis with the radionics device. The practitioner may adjust the dials on the device to match the selected rates, which they believe allows them to transmit corrective energy frequencies to the patient. Importance of observation and interpretation. Radionics practitioners detect imbalances in the patient's energy field by observing the reaction of the instrument's dials, indicators, or other output mechanisms. Like some other natural medicines, practitioners may also use experience or intuition to interpret the information provided by the device and make diagnostic or treatment decisions. Alternative practices that share some similarities with radionics include bioresonance therapy and energy medicine. These modalities work with the body's energy fields to promote healing. In many countries, including the United States and the United Kingdom, radionics is not regulated as a medical practice. If you Google the term radionics, you will be bombarded with information about how the technology shows no promise and is considered a scam by mainstream medicine. So I dug a little deeper and learned that some game-changing medical applications based on radionics or bioelectromagnetics are being used today in both research and clinical settings. Here are some notable examples of current medical interventions based on this Dr. Abrams' radionics theories. First, magnetic resonance imaging, or MRI, uses powerful magnets and radio waves to generate detailed images of the body's internal structures. It is widely used for diagnosing conditions ranging from brain tumors to joint injuries. I'm sure many of you have had an MRI. Transcranial magnetic stimulation, or TMS, is a non-invasive procedure that uses magnetic fields to stimulate nerve cells in the brain. It has been approved by regulatory agencies for treating conditions such as depression and migraines. Electroencephalography, or EEG, measures electrical activity in the brain using electrodes placed on the scalp. It is used to diagnose conditions such as epilepsy, sleep disorders, and brain injuries. Deep brain stimulation, or DBS, involves implanting electrodes into specific areas of the brain and delivering electrical impulses to treat movement disorders like Parkinson's disease and essential tremor. Pulsed electromagnetic field therapy, or PEMF therapy, applies electromagnetic fields to the body to promote healing and reduce pain. It is used in various medical fields, including orthopedics, sports medicine, and wound care. Implantable cardiac devices. Pacemakers and implantable cardioverter defibrillators, or ICDs, use electrical impulses to regulate heart rhythm and treat conditions such as arrhythmias and heart failure. Functional magnetic resonance imaging, or fMRI, measures brain activity by detecting changes in blood flow. It is used to study brain function, map neural networks, and investigate neurological disorders. Neuromodulation techniques such as spinal cord stimulation and vagus nerve stimulation deliver electrical signals to modulate nerve activity. They are used to manage chronic pain, epilepsy, and other neurological conditions. Electrocardiography, ECG/EKG, measures the electrical activity of the heart to diagnose heart conditions like heart attacks, arrhythmias, and coronary artery disease. Electromagnetic fields are used to stimulate bone growth and accelerate healing in fractures, non-unions, and osteoporosis. Transcutaneous electrical nerve stimulation, TENS. TENS delivers low-voltage electrical currents through electrodes placed on the skin to relieve pain, particularly musculoskeletal pain and neuropathic pain. Brain-computer interfaces, or BCIs, translate brain signals into commands that control external devices, allowing individuals with paralysis or neurological disorders to communicate or operate computers and prosthetic devices. Electromagnetic therapy for wound healing applies fields to wounds to promote tissue regeneration, reduce inflammation, and enhance healing in chronic wounds and ulcers. These applications are just a few of the applications currently in use based on this whacked-out theory of electromagnetic energy. If the industries can harness it, so can we. In today's world of misinformation deliberately being spread by so many unlikely sources, we must look deeper than the headlines or the surface message that is being told. Remember that in most cases, every lie is hidden in a field of truth to evade detection. This seems very relevant in areas of health, finances, politics, or any agenda that suits the needs those in control of the media. Radionics is nothing new. It's been around for a long time. I personally have never used it, but many have with positive results. When we consider the general body of energy healing, there is so much information coming out that it's getting hard for the establishment to suppress. The technologies that already exist based on radionics have ushered us into an entirely new world of medicine. I hope you enjoyed this video on this little discussed topic. Until next time, let me know what you want to hear and I could do a video on it.